studies are showing that people have develops a condition called a myocarditis, and myocarditis is where the heart muscle becomes inflamed, and myocarditis can recover completely or it can lead to heart failure. So we are seeing that in young people in Guyana.
That was interventional cardiologist at the Georgetown Public Hospital, Dr. Michael Chin. Myocarditis is an inflammation of the heart muscle which can reduce the heart's ability to pump blood and cause rapid or abnormal heart rhythms. While the actual number of young persons suffering from myocarditis could not be provided by Dr. Chin, he conveyed that most of the patients who are now suffering from this heart condition are persons who tested positive for COVID-19.
We check their risk factors, for example, a young 30-year-old or 40-year-old, they're not hypertensive or diabetic. They don't have the typical factors that are risk factors for heart failure. But when we now do testing, which we can do antibodies testing, their antibody testing comes back positive, suggesting that they would have had COVID infection in the past, and now they have persistent weakness or heart failure.
He noted that persons who have been diagnosed with myocarditis can recover completely if it is detected early. This, however, is a challenge, Dr. Chen said, since most persons are hesitant to seek medical attention.
The patient presents late to hospital. The longer that person waits to receive treatment, the more damage is occurring to the muscle. And as such, that leads to severe damage to the heart and lead to significant heart failure that could be lifelong and even be fatal.
Dr. Chen highlighted some of the most common symptoms of myocarditis.
Patients are having the typical symptoms of a heart attack, such as severe chest pains, which is usually persistent, and it may radiate down the arm to the neck. Usually this pain is very intense and can be sudden in onset, and they may be associated sweating, dizziness, shortness of breath.
Cardiovascular disease remains one of the leading killers both globally and in Guyana. It was revealed in a 2018 report by the Institute for Health Metrics and Evaluation that 32% of the deaths recorded locally were caused by heart disease. While the common risk factors include diabetes, hypertension, and obesity, it has long been debated that one of the leading causes of deaths is hesitancy to seek medical attention. Reporting for the HDP 90 News, Kendell Richmond.